So you twisted your ankle or pulled a muscle and someone says, oh, you probably have a sprain or that's a strain. But do you actually know the difference? Because it matters a lot. In this video, we're clearing up the confusion once and for all. We're breaking down exactly what a sprain is and what a strain is, why people mix them up, and most importantly, why knowing the difference changes how you treat it. Let's dive in. So here's the simple version. A sprain is an injury to a ligament, a strain is an injury to a tendon or muscle. That's it, that's the core difference. But let me explain why that actually matters and what that means in your body. Ligaments are tough, inelastic bands of connective tissue that connect bone to bone. Their job is to provide stability to your joints. They're like the duct tape that holds your bones together. When you think of ligaments, think of the ligaments in your ankle and your knees and your shoulders. They're designed to prevent excessive movement, kind of like your ACL in your knee, right? Muscles are the tissue that contracts and creates the movement. And tendons are the connective tissue that attach those muscles to the bone. So when people say muscle strain, what they usually mean is the muscle fibers or the tendon is injured. Like an example of a strain would be a hamstring strain, a calf strain, rotator cuff strain, quad strain. And so the difference is this: ligaments connect bone to bone, muscles and tendons are involved in movement. That distinction is important because it affects how the injury heals and how we treat it. So let's talk about sprains first. A sprain happens when you stretch or tear a ligament. The classic example is rolling your ankle. When you roll your ankle out to the side, the ligaments on the outside of your ankle get stretched beyond the normal range. Now they just get stretched, that's a simple sprain. If the fibers tear, that's a moderate sprain. If the ligament completely tears, that's a severe sprain. And so sprains are graded on a scale of 1 to 3. Grade 1 is mild stretching with minimal tearing. You'll have mild pain or minimal swelling of mild pain, and you can usually walk on it. Grade 2 is a partial tear. You'll have some moderate swelling, moderate pain. Walking is difficult. This is the most common type of sprain. Grade 3 is a complete tear. You'll have severe swelling, severe pain, and sometimes you can't bear weight, and oftentimes it requires surgery or casting. But here's the most important thing about sprains is ligaments have poor blood supply. They heal pretty slowly. So a grade 2 ankle sprain could take 2 to 6 months to fully heal. And if you don't rehab it properly, you can end up with chronic ankle instability. That's why proper rehab is so critical. Now let's talk about strains. A strain is when muscle fibers or muscle tendons are stretched or torn. The classic example is hamstring strain. You feel sudden sharp pain in the back of your thigh. This usually happens when a muscle is forced to lengthen when it's contracting or when it's asked to do more than it's conditioned for. Like sprains, strains are also on a graded scale from 1 to 3. Grade 1 is mild stretching with some small micro tears. You'll have minimal pain, minimal swelling. You can usually move the area, but it's uncomfortable. Grade 2 is a partial tear. You'll have moderate pain, moderate swelling, and movement is limited and painful. And grade 3 is a complete tear. You'll have severe pain, severe swelling, maybe some bruising, and movement is very limited. This might require surgery or casting like we mentioned before. The good news is about strains is muscles have excellent blood supply. They heal faster than ligaments. A grade 1 hamstring strain could be better in 1 to 3 weeks, whereas a grade 2 could take 4 to 8 weeks. So why does this distinction matter? It's because the rehab is different. With a sprain, especially to a ligament like the ankle, you need to focus on stability and proprioception. Your ligament is damaged, so your body needs to develop better neuromuscular control to compensate. You need balance training, stability work, exercises that teach your body how to control that joint. With a strain, you need to focus on restoring muscle function and gradually returning to activity. You need flexibility work, strengthening, progressive loading. If you treat a sprain like a strain, or vice versa, you might not recover properly. You might end up with chronic problems, and also the timeline is different. A sprain takes longer to heal because of ligaments have poor blood supply. A strain usually heals faster because muscles have great blood supply. Let me give you a practical example. So say you have an ankle sprain. In the early stages, we're not doing heavy strengthening. We're doing balance work, proprioceptive training, stability exercises, neuromuscular re-education. We're teaching your ankle how to be stable without relying on a damaged ligament. Compare that to a hamstring strain. In the early stages, we're doing gentle stretching, light strengthening. We're getting blood flow to the area and starting to rebuild the muscle. 2 different injuries, 2 different approaches, right? So here's what to remember. The difference between sprains, so sprains equal ligament injury and strains equal muscle or tendon injury. Sprains heal slower and need stability work. Strains heal faster and need strengthening work. So if you're not sure which one you have, see a professional. We can do specific tests to figure it out. And once you know what you're dealing with, you can create a rehab plan that solves the problem, right? And that's something that we can do for you, we can help you with. And these are one of the things that where it takes getting this right only early on makes a huge difference, like in your whole recovery. So don't guess, get it assessed. If this video cleared some things up for you, please like it and subscribe. Drop a comment below. Let me know if you have any questions or concerns, what your thoughts on are sprains versus strains. If you dealt with this strain versus sprain before, I want to hear about it. So drop any comments or questions down below and stay tuned for the next video. Thank you guys.